All right, let's go ahead and get started. Hello, everybody, and welcome to the University of Washington School of Medicine, Sharing Your Story with the Admissions Committee webinar. We're really happy that you're here and excited to share some information with you today. Go ahead and get started by first introducing you to the admissions team. I'm actually just going to have folks introduce themselves, and I will go last. So we'll go ahead and start with Sarah.
Welcome, everyone. My name is Sarah Hafner. I use she, her pronouns. I'm the administrative manager here in the admissions office.
Sonia?
Hi, everyone. I'm Sonia Lane. I'm the interview and matriculation manager, and I also use she, her pronouns.
Alexander.
Hello, everyone. I am Alexander Engel, program coordinator here with admissions, and I use he, him pronouns.
And Stella.
Hi all, my name is Stella Yee. I'm a director of admissions. I use she, her pronouns.
Thanks, everybody. And Kisukukit, I'm Dr. Leanna Muski. I am Salish and Kuti from the Flathead Indian Reservation in Polson, Montana, where I'm coming to you from today. I live here in Polson and I work for the Tribal Health Department as a family physician part-time. I also have the privilege of serving as the Associate Dean for Admissions for the University of Washington School of Medicine WWAMI program. So we're really thrilled to have you here today. The group and I are going to go through some aspects of the admissions process specific to UW School of Medicine, what we're looking for, and how to share your story with the admissions committee. First, I want to just take a quick moment to acknowledge that the land on which the University of Washington stands is the traditional homeland of the Tulalip, Muckleshoot, Duwamish, and Suquamish tribal nations. We obviously recognize that without them, we would not have access to this land on which we work, teach, and learn. And we humbly take the opportunity to thank the original caretakers of the land who are still with us. I would encourage you to pause for this moment. And actually, we recognize that most of you are not probably joining us today from the University of Washington, the traditional homelands of those nations, but would encourage you to think about where you are currently, who the traditional folks are of the land where you currently occupy, whether you're at work, at home, or at school. There is the websites listed on the left-hand side of the screen, where if you're interested in learning more about how to acknowledge this with the Duwamish tribes, realrentduwamish.org is a site that you could go to. There's also a map that will tell you a little bit more about where you are and who the traditional caretakers of the land are there. So to get going, let's review the agenda a little bit, just to let you know our plan for today. So we will start and talk to you a little bit about what our goals are for the day. We'll do some, go over what holistic review means in general and what it means to the University of Washington School of Medicine. We'll talk about the various aspects of your application and the interview and how we make decisions on who to invite for interview and then ultimately for acceptance. And we'll go over specific parts of what we're looking for. We'll have a little bit of information specific to reapplicants because we recognize that some of you joining us today have applied before and are interested in how to improve your application and interview. And then at the end, we've left some time for Q&A. So we do have a Q&A function that's available to you throughout this webinar. We are going to try to hold questions unless they're very specific to that, to a point being talked about at the time. We'll just hold all the questions to the end, so keep that in mind. And just a reminder that that closed captioning is enabled on this webinar, and if you'd like to see closed captions, go ahead and click on that option on your Zoom menu at the bottom of your screen. So I'm going to start out first just sharing with you a little bit about holistic review and how that applies to how we make decisions at UW School of Medicine. So what it refers to is sort of this mission-aligned process for selecting applicants to move through the admissions process and ultimately for acceptance. It takes into consideration all of the aspects of the applicant, not just focusing on one, like metrics, like your scores and your grades, or looking for certain kinds of people. It takes all of those things into account. So we kind of break them into your experiences, your attributes, and then the academic metrics. And we take all of that into consideration in terms of what is our mission and how do the things that you bring to the table align with our mission, and what could you potentially contribute to our learning environment, to practicing, and to the teaching environment. The overall mission at the University of Washington School of Medicine is to improve the general health and well-being of the public. That's sort of our broad mission. When we look specifically at the medical student education program, which falls within the School of Medicine, just so you're aware, the UW School of Medicine houses many educational programs, not just the medical school. But when we break it down to what are we really devoted to here in the School of Medicine, in the medical student education program, we have this mission statement, which is sort of newly minted, and we're really sort of trying to steer folks to recognize what are we trying to do in educating our medical students. And it's to meet the mission of the UW to improve the health of the public by educating inquisitive, compassionate physicians who serve the evolving healthcare needs of the diverse individuals while striving for healthcare justice and equity. And overall, we're sort of have the broader vision of empowering students to become the physicians they want to become through this regional medical education process. And listed below or on the screen there are the values by which we stand and we integrate throughout the medical student education program. And that includes, in no particular order other than alphabetical, collaboration, excellence, justice, equity, diversity, inclusion, respect, stewardship, and student engagement and leadership. So in order to meet that mission, the UW School of Medicine is committed to meeting the mission in a variety of different ways. First and foremost, it's by the special relationship with the states of Washington, Wyoming, Alaska, Montana, and Idaho, otherwise known as WWAMI. Hopefully you're familiar with that term and sort of the process of collaboration across the WWAMI region and what that means. But that's what makes UW School of Medicine very unique, is this 5-state regional medical education process. It's committed to training physicians of all specialties to practice within the region, recognizing that there is a critical need of primary care doctors, and particularly those to serve underserved communities, but also knowing that we need physicians of all specialties to meet the needs of those patients as well. Also committed to advancing knowledge and assuming leadership in biomedical research and academic medicine. So we strive to also be leaders in sort of how medicine is advancing. And then of course is very committed to providing educational opportunities for educationally and economically disadvantaged folks. So through the use of holistic evaluation, we're really interested in learning about the story of you. And we encourage folks throughout to be sure to understand who you are, what it is about you that will serve as a good medical student and ultimately a physician, and how do you share that information with the committee in order to reach your goal of being accepted into medical school. So this is sort of broken down into the different parts of the application process, but just to help to give you an idea of throughout this review process, our committee is really looking for all of these different things. I don't necessarily need to read them to you, but just know that these are the different aspects of your story that we glean from the different parts of the process. And it's important for you to understand that and be able to articulate, sort of your motivation and how your clinical exposure and understanding of medicine comes through what you've done to prepare for that. So both in your written application as well as once you make it to the interview process to be able to articulate that. We're also looking for a little bit different things in terms of like more about your problem solving skills, your knowledge base around social determinants of health and medical and health education or health systems in terms of when we ask you questions during the interview. So just know that we really commit to this holistic review process, and that you're not just about your metrics and your numbers or where you come from, your state of residence, but really what is the whole picture of you, and how do you go about telling that story? So now I'm going to turn it over to my colleague Stella to walk you through, to begin walking you through some of the specifics of this.
Thanks, Dr. Muskie. So let's talk a little bit more about motivation. A big question when you apply to medical school is, why do you want to be a doctor? A big pitfall that applicants make when answering this question is saying that they love science and they want to help people. And while this is a true reason, it is also a very broad reason that can apply to all healthcare professions and also professions that are not related in healthcare or patient care field at all. Think of all your biology and chemistry professors who love science and are helping students every day, or the environmental scientists who are involved in research or making policies that protects people from the hazards in their environment. Next slide. So when applicants are being asked their reasons for being a doctor, their motivation for being a doctor, we really want specifics. Questions that you can ask yourself to help you solidify your motivations can include, what can a physician do that other members on the healthcare team cannot? What role does a doctor play in caring for a patient? When others say why they are in medicine, how does that resonate with you? How have you seen this demonstrated? And also, this is really where it's helpful to share anecdotes and stories in your application. Motivation for medicine can also be demonstrated by your activities. For example, what steps have you taken to learn more about being a doctor? Have you engaged with patients and their families? Have you engaged with communities that you want to care for one day? When we look at your application, we want to see that your activities support what you say you hope to do as a physician. Because we are nationally known for training primary care doctors and rural practitioners, some applicants believe that in order to be admitted, you have to say that you're interested in one or both of those things. As a result, we hear a lot from applicants that say they want to be a small town family medicine doc when they've only lived in big cities and shadowed radiologists. And that can come off naive at best and disingenuous at worst. Because 70% of our graduates end up in different specialties than the ones they had in mind when they started medical school, we really want to emphasize that the admissions committee is really more interested in how you know what you want to do rather than what you think you want to do at this point. And in order for you to show the admissions committee how you know that you want to be a physician, being reflective is incredibly important. And you will hear us emphasize reflection over and over again in this talk. Next slide. So reflecting on your activities will tell us what you learned from your experiences and how they motivated you. And your reflection can also tell us about your personal attributes. The background in this slide is a word cloud made from the interpersonal and interpersonal competencies that the AAMC recommends medical students have when they start. The emphasis on others and responsibility highlight how important putting others before self and being responsible are two of the many important attributes we really want in our future physicians. And of course, it's not in the only. A pitfall an applicant can make is describing what they did, but not really showing us what they learned from their experiences. Or they are so focused on trying to show the committee that they did all the right things in their application that they can come across as arrogant or voyeuristic or paternalistic in their writing. When we read through your application, we want you to talk about how your activities impacted you. What did you learn from your experiences? What did you learn about yourself? What did you learn about others? What did you learn about the importance of communication or teamwork or leadership or service? What you choose to focus on in your writing and in your interview will give us insight into who you are and also what is important to you.
Thanks, Stella. We're going to shift gears just a little bit. So I think she did a good job of helping you sort of think about, why are you getting into this in the first place? What is your motivation to go to medical school or to become a physician, and helping, sort of give you some tools to really think that through. Another part of this process, of course, is the academic preparation, and demonstrating that you really do sort of have what it takes, or you've demonstrated that you have what it takes and you've attained some level of competency in the sciences, the humanities, and the social sciences that are really important in having a good foundational knowledge to be a medical student and eventually a physician. So just a little bit of review and a reminder that for the past couple of application cycles, the UW School of Medicine has not required you to applicants to have an Mcat score if they hadn't taken it before. That is no longer in effect. So for anybody who's applying for the entering class of 23 and likely beyond, the Mcat will be required once again. We do accept Mcat scores from 2019 all the way through September, at the end of September of 2022 to be valid for your application for the entering 23 cycle. And just so you have an awareness that if you happen to take the Mcat multiple times for whatever reason, just know that the admissions committee members who have access to the scores will be able to see any score from an Mcat that you've taken in the past. So just keep that in mind. We do have some minimum academic thresholds for our screening process, which sort of gets your application to be reviewed to determine whether you'll be invited for interview or not, and those are listed below. Please keep also in mind that there are, these are meant to help us process the applications. We recognize through holistic review that the numbers don't always tell the full story of each applicant or of any particular applicant. So if there is a compelling reason that you do not meet one of these academic thresholds, if you feel like you are ready, but your numbers don't tell your full story, there is an option to appeal, and I'll talk about that in a minute. One of the things you'll hear us go through as each of my colleagues and I present is we're trying to identify some of the pitfalls that people have made in the past, of perhaps been unsuccessful at either getting an interview or getting accepted. And one of the pitfalls, as you can imagine now going forward, would be to apply without an Mcat, because we will not consider your application any longer without that. So keep that in mind. So we review, like I said, applications holistically. It doesn't mean that academic performance is ignored necessarily. So I think sometimes people feel like, oh, we just throw all the academics out the window when we do a holistic review process, but that's not true. We try to take into account what somebody's GPA, Mcat scores are in the context of the rest of them, what their experiences are, where they come from, what attributes they're bringing. And just to keep in mind in our process that in the spirit of holistic review, 2 of the 3 people who ultimately interview our applicants never see any of the metric scores. That includes the Mcat, GPA, or CASPER. There, like I said earlier, there is an appeals, if you really feel strongly that your undergraduate GPA does not tell the whole story of you, perhaps you did post-bac work, or perhaps there was a compelling reason for an Mcat score, you can reach out to us and ask us to reconsider, but you do have to have, a good support to be able to sort of help us understand who you are and why that makes sense. I do also recommend that if you had some academic struggles for whatever reason throughout your undergraduate career, or you struggled with the Mcat, if there is a compelling reason, help us understand that by telling that in your narrative throughout, so that we can understand the whole picture of you. I think we see a lot of times that a pitfall that folks fall into is that thinking that your low Mcat score is the only reason for rejection. And perhaps what happens is you make it through, even if you're on the lowest end of GPA or MCAT, and you don't get invited for interview. The reality is it's probably not that. It's probably more around the preparation, either the motivation or one of the things that the rest of my colleagues will talk to you about. So keep in mind, we think about things holistically. It may not just be the academics that keep you from moving through on the process. So that's what I have to say about that. All right, and up next, I think we're to Sarah.
Thank you. So I wanted to talk about clinical experiences and what that means for the institution and for our screeners. When we talk about clinical experiences, we're talking about the experiences in which an individual observes and or gains insight into one or more aspects of direct clinical care, right? So these are the experience. This is a broad category, but it's about what you get out of the experience and what you learn. I do want to point out that we used to recommend specifically at least 40 hours of shadowing. And we put a lot of emphasis on shadowing many years ago, but that stance has evolved and has been evolving. And then with the pandemic, obviously, we recognized a need for a really specific shift in what we ask folks to do to prepare for medicine. We recognize that shadowing is not an available option for all applicants, and that applicants can learn about the medical field and the unique role of a physician in other meaningful ways. And I will talk about some of those ways in an upcoming slide. But one thing to make sure you understand is that the key for clinical experiences is going to be that some part of your preparation should include observing or interfacing with physicians so that you can develop a clear understanding of the role and the unique position of a physician relative to the other members of the healthcare team. So it doesn't have to be shadowing where you're watching a physician interact with patients, but there are lots of different ways that you can interface with physicians and learn about these roles. And I wanted to put in here why the clinical experiences are important. These are the reasons that it's so important to us that you really explore your clinical experiences fully. And these are just some of the reasons, right? But we want you to really understand the life of a physician before you start this journey. You're going to put in a lot of time, a lot of effort, and a lot of money to explore and to follow this career. And we want you to really understand what's ahead of you. We want you to understand the good and the bad side of medicine. You know, what do physicians love? What do they have a hard time with? Why do we have issues of burnout in medicine? We want you to understand all these things. We want you to understand not just the physician side, but the patient side. It's really important that you are able to put yourself in the shoes of both the physician and the patient in these scenarios and think about what they might each be feeling. And this is going to be an important part of that reflection piece that we'll come to. It's also important because it's going to enhance your motivation. You're going to learn if this is something that you are really excited to do and you want to be a physician, you should be really excited to do these clinical experiences and to see what a doctor is doing. And if as you're doing these experiences, you find that it's not as fulfilling, it can help you perhaps shift and look at other options that can help you explore your goals. And it can also help you articulate those goals. So my colleague earlier was talking about motivation, and we found that a lot of ways that you can reflect on your motivation can happen in the parts of your application where you reflect on your clinical experiences. So when you talk about your experiences, you can tie that to motivation in a lot of ways. Can I have the next slide, please? Thank you. So here are some examples of clinical experiences. This is not an exhaustive list, but I wanted to give you some examples because I get a lot of questions. We're getting phone calls saying, does this count? Does that count? And as I said on the previous slide, the important thing is that you're getting some sort of interaction with a physician or interfacing with a physician in a clinical setting, and you're getting to see what the role of the physician is like. And ideally, honestly, if you can see it in different ways, it's going to be helpful. So the more that you are able to get these experiences is going to be great. But we also recognize it's not easy necessarily to do these. And that's part of the holistic review process. We're going to be looking at all the pieces, and clinical experiences are one piece. So there are volunteering opportunities that can let you have some of these experiences. Shadowing and in-person or virtual. The essential piece is not so much how you get the experience. Again, it's what you say and what you learn, right? So if you are getting some good observations, some good understanding from virtual shadowing, then absolutely it will work. Scribing and medical interpretation are two paid ways to get clinical experience that can be helpful for folks. And there are some patient care roles that interface with physicians, and I've listed several of them there. There are others. And there are also clinical research roles that can give you physician interaction, research coordinator roles, for example. And the thing I want to emphasize is that even more important than what you do, it's what you say about it. It's what you learn from your experiences and how you demonstrate that to us. Because the number of hours that you have, the quantity of hours is not as important as the quality of the experience and what you learn from it. And you have to show that to us in your application, in your written application, and then in your interview. So we have seen applicants who come in with hundreds of hours of clinical experiences, but their descriptions are just that, they're descriptions. They're not reflective. We don't know what the applicant learned from those experiences. So it's hard for us to consider them as part of the application. Whereas someone who perhaps has been taking classes and working and hasn't been able to do as many hours, but when their application really explains to us what they've learned from their clinical experiences, both about themselves, about medicine, about patient care, those are the folks that are really going to stand out to us. It's the quality of the reflection. I also want to point out there are some options that can be a part of your overall exploration that aren't necessarily physician interfacing, right? So folks who are caring for ill relatives, when you interview a physician and other volunteering roles that might be in the medical system, those can be clinical experiences, but they're not necessary, but without that sort of physician connection, they can be helpful for your complete understanding, but they're not, we don't recommend that that's the only thing that you do. We want to make sure that you have some sort of experiences with physicians so that you're really able to understand fully what you're getting into. So these ones on the bottom can be good supplements if they're experiences that you have, but we want to make sure that you also have some more direct experiences. Thank you. So I had mentioned the importance of reflection on these, and I've included some questions that you can use when you're considering your experiences. We are updating our website to include a page all about clinical experiences. They're going to have a lot of these questions, and in fact, there are even more on that upcoming page. We hope to have it on the website at the end of the week, so you should be able to see it. When that goes live, we'll also post it on our Instagram and Facebook. We have links for those at the end of the presentation, so be sure to be following us on there to see when that goes live. But the idea is, while you're in your experience, after your experience, we want you to be thinking deeply about those experiences, right? So as Stella mentioned earlier, right, it's not, wow, I really liked that, I want to be a doctor. That's sort of the top level. And then you start to dig deeper. Why did I like that? What did I learn? And then you can even go the next level. How did I learn that? What pieces did I put together to make me see how that all fit, right? So, and one way to do that can be helpful when doing this reflection, because it's not necessarily natural. It does take practice to do reflection. We recommend journaling. It can be really helpful after you've had one of these experiences to just open your journal, write down the date, and answer some of these questions for yourself. What did I like about what I saw today? What did I not like? What did I think? Is there anything the doctor did I found particularly interesting or strange or so on? And then dig a little deeper. Just practice writing this out. And it doesn't have to be a physical journal. It can be digital or virtual, however it helps you. You know, you can record messages for yourself, but talking these things out and going deeper can be a really helpful way to practice that reflection. And what's an added bonus for the journal, in fact, is when it comes time to write your application, you'll have some ideas already formulated, right, from your reflections that you can go back to when you are filling out your initial application and your secondary. It can also be helpful when it comes time for your interview. You want to make sure you're using different examples in your application and your interview, because your interviewers will have read your application. So it'll be helpful to bring more examples to your application. And if you have a journal where you've jotted down these ideas and these experiences, you'll be able to, it might be easier for you to draw upon those. So, but these are some examples of the questions. And you can see that these aren't just about you and just about the physician, they're also about the healthcare role in general, about the positives and the negatives, and about the patients. We need to see evidence of your experience and what you've learned, right? So I was on a phone call recently with someone and we were talking about this, and we talked about how the physicians and other folks who are reading your application are looking for evidence to support your claim that you want to be a physician. So you need to support that statement with evidence about what you understand about the role. So think about, that might be a helpful way to sort of think about how this comes together for you when you're writing. Have I proven my thesis that I want to be a physician? What have I used to back up that claim? And just like in a research paper, it's not enough to just say a fact like I did X number of hours of something, right? You also have to then explain what those hours did and how they back up your claim. And that's sort of what we're thinking about. How does your experience support your contention that you want to be a physician? So that framing can sometimes help people think about writing and reflecting. So lastly, a pitfall in applications is just writing the what you did and not what you learned. So the experiences section on the AMCAS application, it gives you 15 options. So there should be plenty of places to put different experiences that you've had. You only have a short amount of space though to write about the experience. So I would encourage you to get away from descriptive words, because for the most part, we are going to know what you mean just from the title of the description, right? If it says describing, if it says shadowing, we know what that means. So rather than tell us that in the description, I shadowed this doctor this many hours, I shadowed this doctor this many hours. Instead, tell us what you learned from that experience. And there's you don't have a lot of space always in those parts of the application, but there's a lot of reflecting you can do in a short amount of time. If you've done this work ahead of time and thought about it and reflected on it in advance, you can really crystallize your thoughts in your application, which is what we're looking for. And make sure that when you're thinking about your reflection and when you're thinking about your experiences and reflecting, you're thinking about the patient role and the doctor role. So that pitfall, if you're in your reflection, if you're only talking about yourself and you're not talking about physicians, you're not talking about patients, that can be a bit of a flag for us, because it may make it seem like it's about you. So also talk about what you've learned about, specifically about being a doctor, about patient interactions and things like that can be really helpful to help us understand how you see yourself in this environment. Thank you.
All right, so switching gears to another thing that is really crucial in the application process, and that is service. Medicine is a service-oriented profession, so it's really, really, really important for the admissions committee to see that passion for helping others in your application materials. So in your primary application, and then in your secondary and in your interview. Service can be local, it can be national, it can be international work, and it certainly doesn't have to be in a medical setting. So that's important. We get a lot of questions about that. It also doesn't have to be an unpaid experience. So paid employment that is working with a vulnerable population is certainly acceptable. Our committee recognizes that not everyone has the opportunity or the time to do unpaid work. So we value that too. The important thing to think about here is that service is not about checking boxes and sort of looking good to the admissions committee, to any admissions committee, or doing what you think somebody wants you to do or see on the application. Stella mentioned this, that a pitfall sometimes for motivation is saying that you want to be, you know, a primary care doc when you don't have any experience in that setting. And that's true here too. So sort of saying, oh yes, I really care about serving people, but that's not represented in your application. Again, it's all about evidence, and that's just sort of supporting what you're trying to demonstrate to the committee in your written materials. Something to be aware of too is that, you know, service can exist in lots of different settings, but we don't want people going into any organization or any community with some sort of savior mentality. You are not the person who is going to go fix homelessness. Like, probably that's not going to be you as one person. So sort of know that too when you're thinking about where you go in. We really want you all to be intentional about what opportunities you're choosing. So make sure you think about why you've chosen whatever activity, whatever volunteer service, paid work with a vulnerable population you're doing, what the benefits were to you of that activity, and then also what were the benefits to those that you were serving, those people and the people you were working with. And again, as we've said many times over the course of this presentation, as we always joke with these presentations, they should just be one slide that just says reflect, like with an exclamation point, because that really is so, so important. So it sort of things that you can prompt thinking about are, you know, what did you learn about yourself in that service setting? What impact did you have on the people you were working with? And maybe how this changed your perspective about a career in service, or how did that sort of strengthen your commitment to a career in service? Those things are all important. And I think the journaling is a great suggestion for your service opportunities too, because again, you sort of want to strengthen that reflection muscle. And anytime, you know, after you're done with your shift working, wherever you're working, you can sort of jot down some thoughts. And we all know that we think we're going to remember, like we have some meaningful experience with another person and we think, oh, well, I'm definitely going to remember that later. I won't forget. But it can be beneficial to have that written down for you for later, even if it's just that really significant experience that you had will feel different to you a year later for whatever reason it is. And you can think about why that might be. A common pitfall here, well, one would be sort of not having any service at all, right? But we hope that's sort of obvious. So the thing we were trying to think about that happens where people don't necessarily realize is that, and if you're a reapplicant who has gotten feedback from us, you might have heard the term sort of get out of your comfort zone. And what we mean by that is that a pitfall can be sort of staying in a setting that feels comfortable to you. So it's maybe with people that a lot of people who are like you, or a setting where you sort of haven't challenged yourself to find something new or different. So we really want you to all think about finding something new and different and working with people from different backgrounds. So an example could be if you have all of your service in your college campus, for example, try to think about, the community outside your college campus. Could be, if you're all your service work is with your church, for example, think about, other people in your community that might need serving and sort of what that looks like for you. So that's sort of what we mean by that. If you have heard that phrase from any of our team or our interviewers or our admissions committee, that's sort of what we mean. Sort of think about things sort of outside what you have done before, and that's really important.
Right, now, I would like to talk to you a bit. If you're reapplying and looking for ways to strengthen your application, I'm just going to start out by addressing that pitfall because everything else kind of relates to that. That pitfall is not changing your application enough. When you're reapplying, you're the same person, but you're not exactly the same person anymore. You've had new experiences, you've had new things in your life that have changed. Maybe you've done more service and you have a lot more reflection to do based on that. Whatever it is, there should be something new, some changes that we see in the application. So I'm going to go through these one by one so we can get an idea of kind of what we'd like to see, where we'd like to see those kinds of changes come in. So one thing to think about, first of all, is to rewrite your personal statement. Don't just repeat the exact same thing. Yes, as I said, you're the same person, but you're not exactly the same person. Show us how you've changed. Show us what new things have happened since your previous application. Show us new reflections. Whatever is new, keep that in there. Whatever is great and strong about who you already are, keep that in there as well. And you want to see this kind of mix of what you had before with what ways you've developed beyond that. Updating your experiences is a really great way to improve your application to make it stronger. That can be through adding additional clinical experience, adding to your service experience. As Sonia just mentioned, seeking out new diverse experiences, serving people or groups of people that you haven't served before, serving in ways that you haven't served before. Look for things that are new and different compared to what you've done in the past. Be intentional, again, about the things you're choosing. Don't just choose a new thing because it's a new thing. Choose it because it's also got value and importance and matches your goals. So that next bit there, make sure your goals are supported by your experiences. So show us that the things that you've done really lead you to being ready to achieve those goals that you have, right? Show us that you've explored all these various different aspects of what it means to be a physician, and that leads you to that point, to that understanding, to that preparedness to be admitted to medical school and to go on into that career. We've stressed again and again the importance of reflection. Reconsider your reflections as you're reapplying. This could mean that you've had new experiences and you're reflecting on those, of course, but it can also mean look at the things you've already done from the window of where you are now. Maybe you're applying 1 year after your first application. During that year, how have your perceptions changed? What new things have you maybe realized about what you've already done? That's all things that you can add into there throughout your reflections. For your letters of recommendation, refreshing those, getting updates. That doesn't mean you have to get a completely new set of letters. It doesn't mean you have to ask people to completely rewrite them, but talk to the people who who did those letters for you the first time, at least get them maybe to update the date, maybe add some information about who you are now, how you've changed in the past year, if that's something they would be familiar with. Maybe consider getting some people who didn't write about you before to write about you now. What have you done in the last year? Maybe in that last year, there's someone who's been really a big part of your life, a big part of the service that you've done, or in whatever other way has some valuable contributions to telling us who you are and why you're ready for medical school. So that's another thing to consider. Waiting to reapply can really be beneficial. We suggest this throughout different stages of the process. Apply when you're ready. Don't apply when you can, apply when you're ready to apply. So in some cases, it may actually be to your benefit to take an extra year or even more before reapplying. So if you applied last year and you really want to apply again, think about what you've done in that time. Have you changed enough? Have you had enough new experiences, enough new reflection to make you a stronger applicant now? Or could waiting another year make you an even stronger applicant and increase your chances? It's worth considering that, thinking about what could I do with an additional year that might really increase my chances of getting in. So that's, I know a lot of people want to think, I want to get in as soon as I can. Sometimes waiting a little bit can make it more likely that you do get in. And ultimately that's more important than whether you get in this year, is whether you make yourself ready and then do get in fact. We have a lot of resources that we provide on our website. You see the link to it there, and we're showing a lot of additional useful resources in a minute in the next slide. But take a look through all of that. Go through all the writing on there. We have a lot of videos, a lot of different things that you can look at to get an idea of what can make you the best candidate that you can be. Look through those. You'll probably have some additional questions after you look through all that. Feel free to reach out to us. You can get to us by email, by phone. Let us know what questions you have after you've gone through all that, and we can help you out. Understanding maybe some of the specifics there that you weren't quite clear on, maybe putting a few of the pieces together, connecting things that weren't as obvious to you when you were looking through the website. And now I would like to hand it back to Dr. Muski to go over the some of those and go over the closing statements.
Great. Thank you, Alexander, and thanks to all of the admissions team for sharing insights in terms of what our committee is looking for, what the School of Medicine is really looking for, how the bits and pieces of your journey thus far sort of all can come together to tell the story of you and how to be able to do that effectively. I hope that that's what you gleaned from what we shared today. As Alexander mentioned, we have a wealth of resource available on our website. There are also other websites that you should, if you haven't already, be checking out through the AAMC, where the AMCAS application is, sort of housed, some tips and some recommendations, sort of on the national scale, but our website focuses specifically on what we're looking for at UW School of Medicine and applying to be a WWAMI medical student. So you can always email us. There's several helpful websites, and as Sarah mentioned earlier, be sure, if you're not already, to follow us on our social pages, both on Facebook and Instagram. We also post a variety of videos to our YouTube page as well, including many of webinars like this. We do them with very specific and different focus at different times throughout the year. So be sure, if you haven't visited lately, that there may be some helpful information for you back on our YouTube channel as well. So at this time, I think we're going to go ahead and open up to the Q&A. And I think perhaps one of my colleagues can start us off by answering some of the questions that have been coming through. I think there were a few we've answered directly, and then there were a few that we wanted to share with the group. So I don't know if Sonia or Stella, you want to take it away.
I'm happy to. I'll answer it. The first question we got is, it says, will everyone who passed the screening receive a secondary application? So this is a great question, because we get this a lot. And here, I push that button. So Dr. Muski talked about, there's the initial academic threshold cut. So if you are a WWAMI applicant, that is the only sort of barrier between you and the secondary application. So if you are an applicant from Washington, Wyoming, Alaska, Montana, or Idaho, and you have met that metric threshold, you will receive the secondary application. And then you have the chance to work on it, and there are a variety of pieces of that application. And I'll reference everybody to our website. And again, that we did a presentation a little while ago called E23 Essentials, which is all about the super specific sort of nitty-gritty details about this application cycle. So I would certainly recommend everybody watching that if you are applying this cycle. If an applicant is an out-of-region applicant, so not a WWAMI applicant, there are more barriers in between the AMCAS application and the secondary. So there's a number of screening processes that go into that, which are all looking at sort of mission fit overall, because we do have a strong preference for our in-region applicants. So if there's a metric threshold, but there are also other criteria that we look for, and that's where the difference is. So applicants who get invited to do the secondary as an out-of-region applicant, there's a lot fewer of them because there's those additional things in between. And then I'll pass it off to Stella. She's going to answer the next question.
Thanks, Sonia. All right, the next question is, how does the admissions committee view required coursework being completed during the application cycle? So our policy about prerequisites is that they have to be completed before you start medical school. With that said, we do encourage applicants to have them done before you submit your application. If you have coursework that's pending that you're working on while during the application cycle, the reality is that we will see that you are taking classes, but we don't know how you did in them. So if you want the committee to know how you did in any prerequisite coursework like organic chemistry, then you might want to have that done before you apply. And that also means having the grade on your official transcript before you send it to AMCAS.
And I would just add, I think, as somebody who does review a lot of applications, I think it's, one of those things, if you've demonstrated your academic and your, sort of preparedness and your ability, and you have a few courses pending, that's sort of a different story than if you haven't really demonstrated you're not quite, you have everything coming up that you plan to complete towards the end. We really do want to be reassured. And if you feel like you can reassure us that you have adequately and will be adequately prepared academically for the rigors of the coursework in medical school, because I'm not going to, it's no surprise, medical school is hard, and it deals with very intense, hard science courses. If you haven't demonstrated that you've, sort of been able to handle some of that kind of course load, your committee member may or may not, sort of, depending on what the rest of your application also shares with us, that may or may not, sort of support your preparation. So just think about those things as you're on your journey to applying.
I'd like to answer the question of, is volunteering at an assisted living facility / memory care facility and interacting with the residents considered clinical or service? And ultimately, the applicant is the one who gets to decide what label something has on the AMCAS application, so that when you're filling out your experiences, you choose the label. And there are things that can fall under more than one label, and that's going to be a choice that you make. So I would just look at so in order to decide, you might just look at everything you have and try to find a balance. But in terms of our committee, they're less interested in sort of the label at the top of the thing, and they're not as much interested in that. They're more interested in, again, that reflection, right? So in your space where you talk about that experience, you talk about it in terms of service, and when you think about, so it's sort of the reflection, right? It's was that experience meaningful because of the altruism, or was it valuable because of what you learned about patient care? So, and it might be both, right? And so it's going to be up to you to sort of decide how you want to talk about that and talk about what you learned. But I certainly think it can be a valuable experience and you can learn a lot of things from it. So unfortunately, there's no cut and dry answer for that. It's not an either or as to whether it's considered clinical or service. Again, it's up to you to label it on the application, and our reviewers are going to look at it as part of the holistic review and part of and at your reflection of what you learned from your experience.
All right, I'm going to answer this going back to the sort of screening criteria. So this person asked, if I don't meet the initial screening criteria, will I automatically be rejected as a whammy applicant and need to appeal, or will my application still be reviewed? So thanks for asking this. Yes, the way we do it is that if you are a whammy applicant and you are below that metric cutoff, you do get rejected, and then you write to us to appeal. So if sometimes we have people write to us ahead of time, so before they submit their MCAS application, and they say, I think I'm going to be rejected because my MCAT is 1 point below the metric cutoff. I'd like to appeal sort of in advance. We don't have the capacity to keep track of that. So it is the right process is to get the email saying that you have not yet, that you're not getting the secondary, and write back to that and say, I'd like to request a manual review of my application based on X, Y, and Z. Can I please be reconsidered? So that is the correct process for doing that.
All right, so we got a question about Casper and how is it considered with part of our admissions? As we've mentioned, we do use holistic reviews. So your Casper score is going to be considered within the context of the rest of your application as just one additional piece of information for us to evaluate your candidacy. I'm going to go ahead and open this up to the rest of my teammates if they have anything else that they want to add about Casper.
I'll just add that, you know, in the face of a holistic review process, we're really looking for multiple ways to evaluate each applicant. And traditionally, it's really relied heavily on sort of objective metrics, and then sort of whatever we can glean from what you tell us. So Casper is meant to sort of bridge some of that, to find some of those attributes that we're looking for that perhaps you've developed based on your experiences and your you know, sort of background in your life. So Casper is ways, so that's how we're utilizing it in the holistic process. We, you know, sort of our committee takes it into consideration, but it's taken into consideration like all of the other pieces of the application. So keeping that in mind.
I'd like to answer a question that came up about clinical experiences. It was, I do not have a lot of shadowing due to COVID halting all shadowing for the past 2 years. I'm applying for the entering class of 23 and was wondering if this is crucial to my application. I do have a lot of clinical experience working with physicians. One of the things I want to make really clear is that we are no longer recommending specifically shadowing, because we recognize the changes in the world have made shadowing more difficult. So it is perfectly okay if you have not been able to get shadowing or very much shadowing. What is important is that you have clinical experiences with physicians, with patients, and can reflect on what you've learned in your application. So so to the person who asked this question, if you feel that you have a complete understanding of there's no such thing as a complete understanding, but a rich understanding of the role of a physician and how you would fit into that clinical setting, then it sounds like you are prepared and you would, but what would matter to us more, again, than the hours and the things that you have done is how you talk about them, right? So that is the key thing. You can have tons of experiences, but if you do not write about them and what you've learned, if we don't see that evidence of what you've learned, it's not going to be as valuable for the folks reviewing your application. Thank you.
All right, I can answer the question about should we tie all our non-clinical experiences reflections back to medicine, and why physician? So this is actually a pitfall that some applicants fall into, where they feel like every single activity down to their honors and awards have to tie back to why they want to be a doctor. Your application is a story of you, and you are many experiences, not just a future doctor. So what that means is that if you have non-clinical experiences, you could reflect about how it's related to medicine, if that's your takeaway. If you had an activity and it's not clinically related, but it is something that was really impactful for you and influenced you into thinking about being a physician, then by all means you can reflect and talk about that. But it might also be an experience where you can talk about what you learned about teamwork, or what did you learn about being a leader, or what you learned about communicating with others. There are other things you can talk about and reflect on in your non-clinical experiences, and they don't, every single one of them, have to be about medicine. Ultimately, when we read your whole application, we should still be able to get a sense of why you want to be a doctor. So that should still come through. But not every single activity in your experiences section has to be related back to being a physician.
And if I could just add to that, that doesn't mean that you shouldn't reflect on your other experiences, right? Because they want to know not just what you've learned about medicine, but what you've learned about yourself, right? So an example would be in your at your part-time job. Maybe you've learned about some characteristics or qualities that you have that you want to make sure the committee knows about, that may or may not be directly related to a medical career, but they want to know you as a whole person. So make sure you're reflecting on every experience, even if you're not specifically tying everything back only to medicine.
Next question. Someone asked for in-state residents or in-region applicants, will we be considered for both MD, PhD and the MD program, or just one or the other? So in-region applicants can apply to both the MD, PhD program and the MD program, but they are separate applications. So you would want to indicate that you're interested in MD, PhD in your AMCAS application. And then we will invite you to complete the secondary as long as you meet the metric cutoff. And then you'll also want to complete the separate MSTP application, which you'll get information about how to do when you apply. So you can be considered for both, but you do need to apply for both. And it's important to know that those two application processes are completely separate. So one doesn't influence the other. We've had applicants get into both programs and be offered a seat into both, and they get to choose. And then we've certainly had people apply to both and gain an acceptance to one or the other.
And I'll address the next question, which is, if we have an MCAT above the minimum cutoff, but still on the lower end of scores, would it be beneficial to retake it? First, I'd like to say that it really depends on the context of your application as a whole. For example, if you have a low MCAT score, but you have very high GPA, those are two things that can balance each other out, especially if you have a very high science GPA. And in a case like that, maybe if you have, for example, a weaker service record, that's something that you would want to focus on more than retaking the Mcat. Look at your whole application and see what strengths and weaknesses you have currently, and take that into consideration when you're making these decisions. If, for example, you have a very, very strong service record, a lot of clinical exposure with some really great reflection on it, and your academics are on the lower end, both your Mcat and your GPA, then in that case, maybe it is a good thing to consider retaking the Mcat. It really depends on making your mind up about which parts of my application are really strong right now, and which are not so strong. So which of those is the most important for me to bolster? Academics are just one part of it. If you've gotten past that cutoff, we're looking at everything. We're looking at the whole you. So don't think I need to do this one thing. Think about the whole application. We're looking at everything. How can I make the whole thing stronger?
Yeah, and I would just say that includes when you're thinking about academics, and I think you might have said this, Alexander, but emphasizing that it includes the whole academic picture, right? So if you have a really strong GPA and you performed really well and you took the Mcat in the middle of the pandemic and your score was a little less than you expected it to be, but not because you don't feel prepared, but because of the situation, that's different than if you maybe struggled through some science courses and barely got by, and then you took the Mcat and you also had sort of a lower score. Perhaps you need to reflect and consider whether you're academically prepared or if it was just a situational aspect of what's going on. So the whole picture is really important.
Another question. The question is, given that AMCAS is now allowing for anticipated hours for activities, do you recommend using one of the 15 activity spots for a future experience that will begin this summer following submission of the primary application? Or would you recommend to use that slot for an additional past or current experience? So I have a couple thoughts on this. The first is that we generally recommend, now this is true for the UW and so not necessarily true for every medical school, so you have to sort of weigh when you're thinking about that. But for us, we always recommend that if you have an upcoming experience, wait, especially if it's in the summer, wait to submit your AMCAS application until that experience have you done enough of it that you can reflect on it. Because again, that's our sort of, main takeaway here is that the reflection is the most important thing. So you can't reflect on something that you haven't done yet. So if and our former associate dean for admissions always used to say, and I will always repeat this because I love it, it's that if a good application is better than an early application. And so if you are, there's no reason to submit on the first day for us. That is not going to increase your chances of getting in. If your experience, if it's going to be after the deadline for AMCAS, that's a different situation. But I would say, if this thing is starting in June that you're working on, I would strongly suggest waiting until July or even August would be fine to make sure that you have time to reflect on it. And, that's obviously up to you because it changes your applications at other schools, but know for us that really the most important thing is the strong application. And some schools will allow you to send in updates during the secondary process. We don't do that about your experiences. So you really want that, all your 15 activity spots in AMCAS to be the best that they can possibly be and to be the most reflective that they can possibly be. And I think there was another question along this same line. Sarah, did you have that you said you were going to answer? Is there something you want to add?
I think you covered it. Yeah, the key, what I always tell folks is, what I remind folks is when the reviewer is looking at your application and they see you have an upcoming thing, they might say, well, that's neat that they're doing something. But they need the evidence, right? Like the thing itself doesn't help them make a determination about you. It doesn't contribute to their holistic review because they need that evidence. They need they need that reflection and what you've learned from the experience. And I can answer a question that came up. How should, oh, right. This was the one that had, that you were referring to, Sonia. How should applicants show reflection upon anticipated experiences? And again, it's not really possible if you haven't done it to reflect on it. You know, if, I think you could certainly talk about why you're interested in it and what you hope to learn from it. You know, you can talk about some of the, maybe your guiding questions going into it to indicate that you've sort of thought about it in advance and what you're going to get out of it. And then perhaps there's enough other evidence in your application, right? Because that's not really going to be counted as evidence, as I said, but there hopefully will be enough other evidence in your application that you'll be invited to interview. And then at that time, you can reflect on some of those experiences that you had in that in your interview. I don't think it's you necessarily have to leave off future events. You know, you can, because 15 is a lot of experiences. So you can certainly put future things on there because I think it can be helpful for folks to see. And again, they might see that and say, oh, I'll make sure to ask about that at interview because they'll have done some of it by then. So it's not that you don't need to put them on at all. Because I do want to say that you should be continuing to explore during your application year. As you know, you apply during the spring, summer, fall, and then it's not until the following summer that you would start medical school. So you want to be doing stuff at that time for your own edification, for your own preparation, but also if you end up being disappointed, you'll have more activities and experiences under your belt for your following application. And frankly, if you really do want to do this as a career, you should want to continue doing these kinds of experiences, clinical experiences, service, etc. So as I said, perfectly okay to include future activities on your application, but remember that you won't have much in the way of reflection to include. And so it's harder for our committee members to take it into account in their overall holistic review.
Thanks, Sarah. There was a question that says, I believe there's a new secondary question this year about the social science and humanities. What are you looking for in the response to this question and how should we approach it? It's a great question because there is a new question. So if you've spent any time on our website, you'll see that we have had some updates to our prerequisite course in terms of how we describe them. There wasn't a ton of changes with the exception of two things. We now require biochemistry. And we just sort of organized them a little bit differently to make it easier about what is biology, what is chemistry, what is physics, what is the requirement. So take a look at that if you haven't, and especially if you applied in the previous season, because we're looking for something a little bit different this year. That gets to the sort of social sciences and humanities section where, you know, when we look at what we're really asking of our applicants in terms of coming prepared to medical school, it's really more about competency in understanding what we've sort of termed the human condition, right? So, and people get there a variety of different ways. So it's almost impossible for us to give you a list of coursework that's really going to help you come prepared to medical school with understanding of what's happening in, you know, sort of the world of being a human on this planet. So we've shifted that to really having you tell us how you've achieved some understanding and some competency in having a sense of what is it that you're getting into in terms of, in the world of medicine as it applies to taking care of people in their communities, people in their countries, people in their states, people in different conditions, people in different situations, understanding how they come to you as a physician to be in your space and how you come to them into their space. So this can be completed and you can gain competency, we recognize, by a variety of different ways. So that does include coursework. So it still includes, sort of humanities courses, things like population health, gender studies, sort of looking at race, looking at specifically at social determinants of health through perhaps some public health courses. So coursework can help you. We also recognize that folks' live experiences often are what they're bringing. And actually that is, a lot of times what we're finding most compelling about applicants, right? So being able to answer the question on the secondary application of how do you understand this and what are the experiences and attributes that you bring? So in terms of how you approach it, you really do need to do that. What did we talk about all day long? Reflection about your own academic journey thus far. In terms of most undergraduate degrees require some level of humanities coursework. So did you intentionally take classes that, one, are interesting and important to you, but also that will prepare you on your journey into medicine, sort of looking at some of the ways that, sort of health and other things affect people. And then also, sort of speaking to your own personal, either lived experiences or experiences that you've been a part of that have influenced your understanding and your competency in this way. So it always comes back to reflection, like understanding what you've done and how it applies to, sort of your overall understanding. And this whole concept was really driven by our current medical students who have asked us repeatedly to ensure that our students are arriving to our school, to the classroom, and to the community there with some basic level of understanding of the human condition and what people are going through and how that applies to their general health and well-being, particularly to, sort of meet our mission of service to underserved populations and in the primary care setting. So we feel like it all ties together, and we're looking for you to help us understand in your story and on your journey how you've reached that competency. Sonia, do you have the next question, or anybody?
Yeah. So this one is, can we only apply to one campus, or is our application considered for all campuses? Great question. So for applicants from Wyoming, Alaska, Montana, and Idaho, you, as a legal resident of one of those states, you are automatically considered for that cohort. So if you list Idaho as your legal state of residence in AMCAS, you are considered for the Idaho cohort, and you don't have an option to change that. Washington applicants have the choice to choose in the secondary application between the Seattle campus and the Spokane campus. So there's nothing you need to do in AMCAS ahead of time to indicate that. You just say that you're a legal resident of Washington, and then you would have that choice in the secondary application. For out-of-region applicants, again, there is no choice. It is just the Seattle campus as your option, so you wouldn't see that as a choice.
Received a question, would only applying to the WWAMI program and no other medical schools negatively impact my application? We do strongly recommend that you apply to more than one medical school. Basically, if you're only applying to us, yeah, that tells us I really, really want to go there, but it doesn't tell us I really, really want to be a doctor. So you can look on our website and you'll see what the acceptance statistics are. It is competitive. Many people don't get in who apply. So if you're only applying to us and hoping that you're going to be one of those few people, if you're not, then you're not going to medical school, at least not this year, right? But if you are applying to other places, if you have other options, that shows you really are dedicated to being a doctor, even if you don't go to your first choice school. And that really shows stronger commitment to the goal. And the goal is to become a doctor. The goal is not to go to our school. That's just one step on the way to achieving the goal of being a doctor.
But to clarify, we don't actually know while you're in the system if you've applied to other programs. So our committee has no knowledge of what you are doing in the rest of your application cycle. What we do see is after the application cycle is over and people reach out to us for feedback, that's when we learn that people are not applying to as many programs. And that's when we have seen that this does happen where people apply just to us. And that's where we have built this, the strong recommendation that Alexander talked about to apply broadly. I would recommend when looking at other medical schools to apply to, look at the mission statements. See if their mission aligns with your goals. Certainly do that for our school as well, because you are going to be more successful at a place where your mission aligns with their mission, not only as a physician, because you'll, if you're mission focused, it's going to be more fulfilling, but also the school is more likely to accept you if they think that you're going to help them accomplish their goals. So, so again, we won't know if you're only applying to us, but we strongly recommend that you apply broadly. And there are lots of wonderful medical schools in the institution. And one thing too, I will say, or in the country, and one thing I will say, people tend to think that especially folks who come from disadvantaged backgrounds, think that they can only apply to public schools because public schools don't cost as much as private schools. And I just want to throw out there the reminder that public schools, while generally their tuition is less, also often, and not all, but often have less less endowment and scholarship money available. So that often actually folks end up spending less overall or have a lighter debt load when attending private institutions. So don't hold back from exploring both public and private institutions when considering which schools to apply to. Because ultimately the goal is to become a physician, and we certainly want that for all of you.
We got another question, and there's been a couple questions about sort of Seattle and Spokane, sort of how to choose between the two, and they were answered just by chatting back, but because there have been a few questions, I just sort of wanted to raise this. We got another question that says, in the secondary, do we have to select only one location, so either Seattle or Spokane, or can we be considered for both? That you just have to choose one between the two, and if you get an interview, you are interviewed at either location, and then that location is where you would be if you gain admission. That is where you are going, so you can't change. You could theoretically change if you had something catastrophic happen prior to your interview. So if you said, you know, I want to be in Spokane or I want to be in Seattle, and then you haven't had your interview yet and something changes, you can change it prior to your interview, but you can't change it after the interview happens. So if you interview for the Spokane cohort, you're being considered for admission there. And if accepted, that's where you would be attending medical school for your foundations phase. Know that the mission and the vision and the values is the same for all of our programs. So everyone in WWAMI is part of WWAMI, regardless of what foundation site you start your curriculum at. And it is the first 15 months of your medical school training. So think, you know, medical school is 4 years at a minimum. Some people, you know, take a year off to do research, those sorts of things. So it doesn't dictate what you do in the rest of medical school. We get that question a lot in terms of, you know, if I'm in Laramie for my foundations, does that mean I don't get to do rotations in Alaska? And it certainly doesn't. All of our students have the option to do rotations all around the WWAMI region, and it is required to do rotations, not necessarily in every state, but it is required to do rotations both in Seattle and outside of Seattle, just for sort of the logistics of getting everybody trained and giving everybody broad access to all that the WWAMI region has to offer.
All right. Well, it looks like we're coming close to time and our question bank has slowed down. I don't know if there's anything else, the admissions team, that we thought of that we wanted to be sure to share with our guests today. I think we've done what I hope we've accomplished for you today is helping you understand how to tell your story to us and the other medical schools that you will likely be applying to, keeping in mind the things that we're looking for, encouraging you to, as was said earlier, understand, sort of as you're researching schools, what are their missions? Is it a good fit for you? And then recognizing that you may have to, sort of adapt a little bit to be a little bit more broad. But once we, sort of invite you for interview, that's when we really get to, sort of hear and learn more about you, and you can be a little more specific. So we do hope that you will check out the resources that we've encouraged you and we've shared with you here today, and continue to follow us for any updates or new information that we have. We always, sort of put those on our both Facebook and Instagram pages. So hopefully you're following us there and you can stay up to date. We do look forward to, getting to know you through your application and hopefully your interview at some point in the future. And, welcome questions beyond this. Just know that this is the beginning of your journey, and we hope to be part of that as we go forward. So take good care of yourselves, stay safe and healthy, and we'll see you again real soon. Thanks for coming.